Welcome. Thank you all for being here tonight. My name is Cheryl Cook. I am the chairperson for Simsbury's Community for Care. The Community for Care was formed to provide information and resources to our community on the topics of addiction and mental health. The committee is appointed by the Board of Selectmen and is made up of parents, teachers, administrators, social services, providers, clergy, law enforcement, and concerned citizens. Most of our programs are taped by SCTV and are available for viewing on the SCTV website, and the town website under the Community for Care title. We'd like to thank SCTV and their volunteers who support our mission. Please take a minute to fill out the form on your chair to help us provide information and opportunities for discussion that you would like us to consider. Your questions and comments are an essential part of this event tonight, and we welcome your participation. It is my pleasure to introduce our moderator for tonight's discussion, a Simsbury resident, Mr. Tom Steen. Thank you.
Thanks, Cheryl. Now it's official. Everybody hear me? I'm good in the back. Everybody good? Thank you all for attending. This is a great turnout and obviously a very important topic, and this is your forum, so please ask questions. While you were coming in, we handed out little pieces of paper so you can be anonymous, and just write your question out, and we'll collect them, and I'll certainly read through them, and we'll pass it on to our panel. I'm going to do my best to introduce everybody, and I know everybody by first name on this table, and I don't know their last names very well, so I apologize if I mispronounce. But certainly that's not important. A little bit about me. I'm a 16-year resident, not retired Y director, now a master trainer in suicide prevention training, and we'll be doing some things in September. Got to sell my end of the program. But I'm also the past 7 years worked in prevention field, and vaping has become a very important issue, not only for Simsbury, but across the state. All the surveys that schools are doing have now heightened awareness to this whole vaping issue, so I think the topic is going to be very powerful. So I'm going to start. My good friend Jennifer from the Farmington Valley Health District is here, and I think Jennifer's great in kind of creating put a frame around the picture of what's going on with vaping through our community. So I'll turn it first over to Jennifer.
Great, thanks. And I have to advance slides, so I'll be standing back here, otherwise I wouldn't be. Thank you very much. It's a great opportunity for me to be here. I wanted to first start by saying that the Farmington Valley Health District is a regional health department, but we're the municipal health department for Simsbury and 9 other towns, and I'm your health director. And this is a really important public health topic, and I've had the pleasure of being a guest here on multiple occasions, talking both about this issue and also the opioid epidemic. So I hope that you'll continue to use and see the Farmington Valley as a public health resource for you as you advance your important work through the community of care. About a year ago, some of us were here speaking on this topic, and at that point in time, I had titled my presentation, Vaping, a Growing Public Health Issue. And today, as I was thinking about my slides, I thought, wow, I think I need to cross that out and say this truly is the next major public health crisis for our youth and for our communities. If you have been watching the news or paying attention at all, there have been some national reports that have talked about the fact that the use of vaping among our youth population is doubled in the last year. And the researchers who conduct that work and have been involved in researching substance abuse practices among our youth over the last 40 plus years say never in the history of their work over the 44 years or so have they ever seen that type of a dramatic increase, whether it be alcohol use, cigarette smoking, you name it. This is a growth in use of the likes they've never seen before. So, just as a little bit of background, electronic nicotine delivery systems, we're referring to it mostly as vaping. That's the most common tool, but e-cigarettes, e-hookah, vape pens, these are all somewhat used synonymously, although they look a little different, they operate a little differently. They've been on the market for any number of years. They were first introduced as and marketed as a tool for current cigarette smokers to wean themselves off and become less dependent or to stop their smoking addiction. Quite frankly, there is very little literature indicating that these devices are in fact effective in helping people quit smoking and become and get rid of their nicotine dependence and addiction. You will see some samples of these firsthand. On the right, I wanted to share a picture of what is the most commonly used product currently by our youth, and that is what is called a Juul product. It's easy to conceal. It looks like a flash drive. So if you see something like this, you might question, is that a flash drive or is that a product that's being used to vape? So as I mentioned, the most recent studies have indicated that the use of vaping products has doubled in the last year nationwide. These are some Connecticut-specific statistics. So 14% of all high school students, so this is approximately grade 9 to 12, are currently using some type of electronic nicotine delivery system. And that increases to 20%, or 1 in 5 of our 12th graders are currently using. This isn't kids that have just experimented once or ever used. This is regular use of a vaping type of device. And 67% of our students that are surveyed that are currently using some type of electronic cigarette are also using some other form of tobacco, most typically cigarettes. So it is a very widespread problem, and if these trends continue, these numbers are only going to go up. So what is the youth attraction to e-cigarettes, and why have we seen such a dramatic increase? Well, one, it's perceived to be far less dangerous among our youth than typical cigarette smoking. And the unfortunate part about some of this is we had actually begun to see a decline in youth tobacco smoking in Connecticut. And I'll talk a little bit about how e-cigarettes are actually likely to reverse that trend over time. We have seen a very purposeful, in my mind, marketing campaign that is truly directed at our youth. For instance, flavored product. I don't know many adults that are particularly attracted to cotton candy or, blueberry jam or, some of these kind of very creative but also very targeted advertising and flavors specific to children and youth. Kids by very nature right now are and have been attracted to, more high-tech types of things. They're hot into technology. This is seen as something that's kind of high-tech. Obviously, our adolescents are prone to, experimentation, etc. So there is a natural curiosity, and because of its widespread use and growing use, this is the next thing that kids are experimenting with and being exposed to. much like cigarettes were marketed and advertised way back when, these products are being advertised in a way that really appeal to youth, using cartoons, using characters that appeal to youth, using sporting events and celebrities that youth look up to, etc. All of those very successful marketing campaigns from the tobacco industry are being applied to the vaping products as well. The vaping products can cost less than, and even the refills of the vaping pods can cost less than cigarettes. I don't know how many of you I think a pack of cigarettes now costs upwards of $15. And e-cigarettes are extremely easy to hide, both in terms of the physical look of them. You know, you could have it in a backpack and someone might not even question what it is. It might be mistaken for, like I said, one of the little USB flash drives, yeah. And also, when we were kids growing up and we experimented with tobacco, when you walked into the house, your parents could smell it on your clothes, smell it on your breath. This is very easy to hide. It might smell like, fruit or a perfume or something like that, or someone might not even think twice about what they're smelling. So, one of the things kids ask is, are electronic nicotine delivery systems safer? The answer to that is, in some ways, maybe they can be perceived as safer. So unlike a cigarette, you're not inhaling tar and some of the other byproducts of combustion. However, they're still delivering things that are very harmful, and I'll talk about that in the next slide. The thing that really is disconcerting is that a lot of kids that start with an e-cigarette are more likely, as I mentioned earlier, to move on to a tobacco-based product over time. So we may actually be seeing a reversing trend in tobacco use. And tobacco and cigarettes are, even if e-cigarettes are a little bit safer in some regards, tobacco kills 50% of the long-term users of that product. I mean, that is a very significant and detrimental health outcome. So, we have to really be careful about, the transition from electronic cigarettes to tobacco products. So, a couple things that I just want to quickly touch on is, one, nicotine. Well, the human brain is still developing up until the age of 25. And so we know that nicotine and exposure to nicotine adversely affects the developing brain. And this can happen in a number of ways. We have direct correlation between nicotine and addiction to nicotine and mood disorders, impulse control, and then of course our learning and our attention deficits can be attributed to exposure to nicotine in the developing brain. In addition, the younger someone is introduced to an addictive substance such as nicotine, they are far more susceptible of becoming addicted to that product. And I want to emphasize that there is currently really no regulation regarding the amount of nicotine that can be used in these products. And one particular very popular vaping device, one vaping pod, one pod that you recharge, and we'll have some demonstration of that, contains as much nicotine as a single pack of cigarettes. And in the youth services surveys that the Connecticut Department of Public Health has done, most current users of vaping devices are reporting using at least one of these vaping pods a day. So 1 pot a day equates to a pack a day smoker in terms of nicotine exposure. So if you think about the trajectory to nicotine addiction, when you're being exposed to that much nicotine in a single day, it happens very rapidly, and youth who become addicted have far more difficulty quitting eventually than adults. In addition to the nicotine, I just want to step back and say not all vaping liquids include nicotine, although many of them do. Some are just the flavors. Even the flavor-only pods present health risks. Some of them are acute and more, more irritation and maybe fleeting, eye, nose, throat irritation, stomach upset, etc. But e-liquid is also made up of components including propylene glycol, glycerin, food flavorings. Really, there is very little at this point regulation and or required labeling of what is in those products. All of that aside, when those things are vaporized, an aerosol is created. Those products, those chemicals are inhaled deep into the lungs and can cause long-term health impacts. The science and the research regarding long-term use of these products is still emerging because it's still a relatively new product, but we can anticipate that we will be learning far more about these long-term effects over time. There have been studies that have looked at different types of vaping products, and there have been at least 10 substances that have been shown to be known carcinogens, including benzene. Benzene is one of the most carcinogenic substances that we know, and so there's exposure to these things as well. So I won't go into a lot of detail, but as I alluded to, there up until this past year, there were no requirements for FDA to actually require warning labels. So the government and the laws and the regulations are kind of catching up to where we need to be relative to warning labels, requirements for the actual contents, etc. As you all know, the current age of purchase is 18 or older in Connecticut. There are fines, and I think we'll be hearing more about how that is playing out with our youth in the school systems and in our towns. Vaping we do have a Clean Indoor Air Act, which was established in the 1980s. Vaping products and e-cigarettes are included as part of that Clean Indoor Air Act, which prohibits their use in state buildings, healthcare facilities, retail, food, school buildings, etc. Although you will be hearing about the challenges associated with enforcing that, given the fact that these are so very easy to use discreetly and undetected. Hopefully we can have more of a dialogue around, in this room regarding prevention strategies, because that's really, really the key. We need to stop early uptake and exposure to these products. We need to be encouraging tobacco-free lifestyles as a norm, and we need to be talking more realistically with our kids about the risks. This is challenging. There's a lot of information out there on the internet. The kids probably know and have read more of that than we have, some from less than reputable sources. So we need to be working with them to kind of sift through and really synthesize what types of information is out there and what is good information and reputable resources and which aren't. I think you'll be hearing more. It's gaining some traction around increasing the legal age of purchase for tobacco products, including vaping. This is an initiative called Tobacco 21. It was introduced last legislative session and died. It is going to, by all indications, be introduced this session, and we all have an opportunity to communicate and advocate with our legislators about our position on this. The Institute of Medicine, which is a very reputable national organization that does a lot of research around public health and medical related issues, estimates that by increasing the age of purchase to 21, it will reduce vaping and tobacco uptake by as much as 25% for kids the age of 15 to 17 and 15% for kids age 19 to 20. So this could be a really important strategy in curbing that early introduction to these products. Similar to what we did with cigarettes, we need to be limiting point of sale advertising, access and placement. And we can all be doing more to advocate for tobacco-free outdoor spaces, parks, playgrounds, etc. So the kids aren't seeing this as being an unacceptable norm in our communities. So with that, I will stop and we'll turn it over, I think, to our resource officers.
Cool. I'm Officer Cormier. I'm the school resource officer over at the high school. I've been a police officer in Simsbury for 7 years, and this is my 4th school year at the high school.
I'm Todd Kushman, also a school resource officer. This is my 13th year at the PD and 6th school year. I have the middle school and the elementary schools. We have some of the actual samples, similar to the pictures you saw on the slides there. So in a little bit, we'll walk around and let you guys see what it is that we're dealing with. With some of these, you'll actually smell it. It does get a little irritating when you're next to it for too long, but.
So I'm going to talk to you guys a little bit about what we do at the high school level as far as enforcement and trying to help the kids out education-wise as well. So the school does a really good job in keeping us involved with teaching the health classes, especially the drug addiction class. And we've actually added this onto the drug addiction portion of our class. Towards the end of the class, we'll start talking about tobacco use and obviously our new form of tobacco use through e-cigarettes and vaporizers. So when we first started finding this stuff out, we saw a huge trend in students using it, and we're going to talk a little bit later about numbers as far as what we've seen as far as arrests go and whatnot. But typically, students from the ages of 16 and 17 are given fines of $50 if it's their first offense, and it's $100 if it's their second offense. If you're under the age of 16, you get juvenile summons. But the nice thing in our town is we have a juvenile review board, which keeps the students out of our juvenile justice system, and we kind of take care of it on our town level, which will be talked about later on. The school's doing a good job as far as keeping an eye on the bathrooms where we've seen most of the use of the vaporizers. But being that these things are so easy to not detect and easy to hide, students have been using them in classes as well, and teachers are actually educated very well on how to detect this stuff and watch students and what to look out for, because when they first came out, they look like little USB chargers that you would just put into your computer. So when teachers first started seeing these things, they thought that they were just USB ports or plugins that they were putting into their computers, not realizing that they're actually charging their vaporizers in class. But we've educated the teachers. Obviously, Mr. O'Brien, who's in the back here, is the principal at the high school. He's done a good job as keeping me involved in teaching the teachers during their professional development days on what to keep an eye out for. We've currently, not only have we seen the use of the nicotine, we've also seen an increase in the use of the THC vaporizers, which is the liquid form of marijuana. A large increase in that. And a lot of the times, for the past few years that I've been there, I've found that students would rather use marijuana than drink alcohol. And I think it's just because of the recent legalization in local states around us, and they feel like it is okay and acceptable and less harmful. And I have these discussions with the students during their drug addiction courses. A lot of them, like was stated before by the director here, that they feel like the use of the vaporizers is healthy, and that it's okay because it's not a cigarette. And we talk about, you know, what their thoughts are on cigarette use, and you should see their faces. It's like disgust, like it's a horrible thing to do. But it's not that. That's not the expression I get when I ask them about vaporizer use. A lot of them, when we find students using them, we ask them why, because these things were made to help people stop smoking cigarettes. So we ask these students, were you a cigarette smoker, and this is what you're trying to do to get away from it, and their answer 90% of the time is no. And it's just something they picked up because they felt like it was safer. And as far as the THC use in the vaporizer goes, it's a lot easier to use because the odor isn't detectable. It'll smell like marijuana for a faint second, and then it'll disappear. So it's a lot easier for them to carry into school, use it in the classroom or in the bathroom, and walk away and not be detected by it and walk around school high. But we've seen a decrease. Honestly, I could tell you that we've seen a decrease in students getting caught in vaporizer uses, and I don't know if it's because of the enforcement actions that we've been taking in our schools. But I still feel as if the same number of students are actually using them. They're just being smart about their uses.
Due to the uptick at the high school, in the health classes at the middle school, Mr. Baker's the principal of middle school over there, we did start incorporating a very similar lesson into the health classes at the middle school. Because of their access to social media, because of their access to YouTube, because of their access to all the technology, it's easier for these kids to Google it, find out how to use it. Their interactions with older kids via social media, they have many more avenues to get in touch with somebody who already has one, so they don't have to worry about the 18-year-old. They don't have to worry about the store. If a kid has gotten a new one, they just buy the old one off an older brother, older sister, an older friend, an older sibling. Secondly, we've seen some where they're delivered straight to the house via Amazon. That under 18, if you already have an account, and those of us as parents, if you have an account and your kid has access to it, they can purchase some vaporizers, have it delivered right to their house or a friend's house or somebody else's house using Amazon, and the 18 thing, you don't have to show an ID, you're doing it on Amazon. So they have access to several different ways to access the actual equipment. And at the middle school, the same thing applies as far as the image of it. If you just walk around and ask kids, they know who's doing it. We haven't got to the point where they just fess up and tell us who's doing it, but they'll say there's a healthy majority of kids that have tried it or regularly do it. They also think the same thing, that it's nowhere near as disgusting as cigarettes would be. And detection-wise, again, it's very hard. These look like every other technology thing. You slide in your pocket, you can't see it, you can't detect it. The smell, again, like those of us who had friends that smoked and was in school, you could tell for hours. In the bathroom, you could tell for hours. After they leave, if they left class and came back, you knew exactly what they did or what somebody did while they were in there. This just doesn't have that same effect. So detection-wise, it's much more difficult for you at home, for us at school, out in public. The cloud of smoke is not nearly what you would be seeing through a cigarette. There are some of the other bigger vaporizers that you've seen, and kids like to watch the videos on these competitions where how big a cloud of smoke you can make. That's the other attraction, is a competition. It was mentioned before that one of the pods is equivalent to 20 cigarettes. They don't see it that way. It's a little pod with a little bit of liquid, and even if you tell them that, it's very hard for them to comprehend how bad that is. The comprehension is just not there. And the flavors, again, there is no doubt. For example, this is blue raspberry candy. There are some warnings on them, Mr. Salty, and this one is strawberry funnel cake. Again, they're clearly not marketed at adults. with those type of flavors. So unfortunately with laws and prevention, the more we learn, then the quicker we're trying to keep up, but we're always going to be behind trying to figure out what's coming out next and then what to do about it.
One thing we've been doing as a police department to help with the prevention of youth using these items is we've been working with Demas to do random checks on gas stations and other convenience stores in town that might sell these items. So what Demas does is they've come in with 3 or 4 underage kids that can't purchase this stuff that work for the state of Connecticut, and they go in and they try to purchase these items. And if the tenant allows them to buy it, then we go in and we give a ticket to the tenant, and they're reported to the state of Connecticut that they sold to underage. I could tell you this, we've only had, the past 3 years that I've been doing this, I can remember I've only had maybe 1 or 2 of these stores in town that have actually sold to a juvenile. And those tenants have been dealt with, and they've been dealt with through the state of Connecticut. But what I can tell you through students that I deal with, they just know which 18-year-old senior to go up to and walk to the gas station to go buy it for them. And they might pay them a little extra. They might give them $20 to go buy a 15-pack of pots. And now the senior has $5 extra in his pocket. So it's not more or less the problem of the store selling it in town. It's coming from, within the youth and their friends. I guess at this point we can get up and start passing some stuff around. Do you want to pass around? I'll talk up here. All right. We'll get up and make it easy. All right, so Officer Kushman's got in his hand are those 2 little jars of vape liquid. You can pass it around and smell it if you'd like, but those aren't harmful to you guys as they are in those cans. But those are what we would see being used by students in maybe a bigger vaporizer like this one. That is a refillable vaporizer, cylindrical vaporizer with a tank at the top. The other ones that Officer Kushman has handing around are those Juuls that were spoken about before, that are the most common used by juveniles. Is it okay if I ask if there's any questions right now? Or?
Sure.
Does anyone have any questions while we're passing those around? Sure.
What do you do if you see like a cartridge on the ground?
So that's a good question, because I was going to talk about that.
Can you repeat your question?
Okay, sorry, I got to repeat the question. What do we do when we see the pods on the ground? I was going to bring that up earlier. The pods usually that we find on the ground or in the bathroom, in the trash, or in a toilet, they're most likely empty, and we like to consider those like a butt of a cigarette. So what happens back in the day when kids used to smoke cigarettes in the bathroom and they were done with the cigarette and they threw it out in the toilet? Right? It's the same thing with those empty pods. We just treat it like that, and we have to throw it out. It's going to be hard to identify whose it was from that.
Officer Cormier, what if kids themselves see it on the ground? Should they?
Yeah, so typically what we ask students to do is report it to their principal or teacher, or, sorry, I got to repeat the question again. That's good. What do we recommend students to do if they find the pods in the bathroom or on the ground? And we recommend them to find a principal, teacher, or closest adult and just let them know what they found and where it is.
For the example that you gave about younger kids going to 18-year-olds to buy things and the 18-year-olds getting a cut of the profit from that, are there any consequences to an 18-year-old if they get caught doing that?
All right, so are there any consequences to an 18-year-old if they're found purchasing for a juvenile? Yes, there is a fine that can be used to charge that 18-year-old with, but I can tell you most of these kids aren't going to tell us who they bought it from. That's pretty hard to find out without coercing them to do that, and we try not to do that. So,
Any other questions? Yep.
in the back.
Can you just point out a different device, one that might be notable as the THC one? So
Yep.
that you'd be able to
So I'm going to point, her question was, can we point out THC pods? So these are the tips that were located that are empty THC pods. As you could tell, they're more of like a glass with metal mouthpieces. One has a plastic mouthpiece, and they actually attach to like a pencil type battery pack on the bottom. So where the Juul is more of a rectangular battery pack, those will attach more to a cylindrical battery pack, which we don't have.
Officer, where do students obtain something with THC?
Okay, so where does students obtain the THC pods? Same dealer that will have their marijuana, unfortunately. And now that Massachusetts is legal, it's a lot easier to obtain it, especially in this part of the state, being so close to Massachusetts. So we found that students know who to get it from, and it's very easy now with Massachusetts being legal. And I'm sure it's coming over the border, pretty frequent, and it's just hard to those are so hard to smell because with the actual marijuana, you don't have to burn it to smell it, whereas that, you have to burn it to smell it. So you're not going to know if we conduct car stops on people coming in from Massachusetts, we're not going to know if they have these items in their car or not. It's not as easy to detect.
The little tiny pods that are like green and black, I think go into Juuls.
The box.
Are they refillable or no?
All right, so are the square pods refillable that will go into the Juuls? So the Juul pods that are purchased in those boxes are not, but they do sell pods that are reusable pods. So you can fill it with whatever juice you want, and I've seen THC being used in those refillable pods.
We have another speaker. If there's any more questions of the police officers, we can hear from Kristen, and then we can open it up for more questions too. I know we have the little pieces of paper, so and if anybody has any, just pass them down the row. Certainly be able to read them off after we hear our next presenter.
Thanks, Tom. Hi, I'm Kristen Formanek. I'm here as your Director of Community and Social Services. I am a social worker, and I'm also a mom of 2 teenage girls. And not to talk about what's already been discussed, but the points that I wanted to share with you, some concerns that we're seeing in school as a parent, thank you, Jennifer, is the concern of the bodily effects that it's having on the individual. As Jennifer had mentioned, the chemicals that are in these products not only contain tobacco, but many other chemicals that are having an instant impact on your child's system. So we know that it's impacting their neurological system right away, it's impacting their cardiological system right away, and it's also impacting their digestive system right away. So if you can imagine your students in school, they're in class, and they're taking a few hits from this Juul, how are they then able to focus on their studies and focus on what the teacher is teaching them? So that's one of our concerns, school-based concerns, is that they're not readily available to learn when they're actively participating and using a substance right in class in front of the teacher or behind the teacher's back. We've also heard from other students that it's very distracting to them. To have classmates that are sneaking this behind the teacher's back. We know that they'll put it up their sleeves and then can take a puff, and when the teacher is writing on the board or looking down in their paperwork, the student is then expelling it, and the teacher does not necessarily know who has done this. As you have heard from the officers and have seen from what was passed around, this is very easily disguised by our children. But you may have noticed, particularly from the large bottle of liquid, that it is an offensive odor. I had actually borrowed these products to do a taping with Jennifer a few weeks ago, and I had to stop my car and put it in my trunk and open the window because I was feeling the effects just from the odor of the liquid. So be aware if you start smelling something very super fruity or different about your child, because as we've said, these are hard to find. But if you can, be vigilant about what you see your children doing, or if something smells different or seems off, question them, ask them if their friends are participating in this, because as we said, it's oftentimes purchased or gotten from their friends in school or online. One of the other things that I wanted to share with you, which Officer Kushman had mentioned, is our in-town juvenile justice diversion system. We do have a very robust juvenile review board here in town, and I'm the co-chair along with Detective May. And that program is something where we have designed through the juvenile justice system the opportunity for any youth who is experiencing their first offense to sit before our board rather than going to the juvenile justice system and sitting in front of a judge. So any student that is, or child under the age of 18 that has not previously been arrested has the opportunity to come and sit before our board. And that allows them not to go through the system, not to have any indication or implication on their records from a judge. When children come before us, we do let them know that this is their one and only chance to come before a board like this, and if there's a subsequent offense, then they would be going into the court system. I wanted to share with you that over the past 14 months, since I've become director, we have heard 14 cases through our JRB, all involving vaporizers, all involving Juuls, and 6 of those cases also involved marijuana. So our kids, our youth, are getting into trouble with these devices. They are using them, and I can tell you in all these instances, the parents did not know that this was happening. In particular with the marijuana, because as was mentioned, it's so easy to hide now. This wasn't when we were growing up as children, and if you got a bag of pot from your friend, your parents were going to probably smell it in your bedroom. This is so easy to hide, so easy to do right under someone's nose. So just please be vigilant and talk to your children. Our Youth Service Bureau is another component that I'm involved with, and that involves cross-collaboration between social services and with the school system and the police officers. And we're focusing this year, our theme is called Make the Right Choice. And we're going to be providing more information to the students in school during the month of March on making the right choice, and part of that is going to include not choosing to use these products. So thank you.
Thank you, Kristen. I'd like to open the floor up for more questions, and any of our panelists, please repeat the question once it's asked so that our folks in TV land can hear. So, gentleman in the back, yes, sir.
My name is Julian Hart. Excuse me. I work at the Simsbury Pathways Program here, and I run an outpatient addiction program. So I started that thing. To go with the officer had with little capsules, you mentioned that there are varying degrees of nicotine in vape. There's varying degrees of THC in vape. Now this is posing a real problem when you said this is an emerging. I get tired of the word crisis. We deal with opiate addicts. We get detox. We have an outpatient detox program. Kids who are using painkillers. It's sad to say we're in the fentanyl phase of the opiate addiction. I've seen kids come in who are smoking pure THC in those pens. Now, there's a difference between 7% THC and 9% THC. So, and there's different strains of marijuana. We have seen kids come in with major psychiatric problems, anxiety, depression, and this has been a historic, different type of outpatient program. I've seen psychosis, secondary to marijuana use. I test the kids who have been vaping. They have extraordinarily high blood level of THC. So this is a different drug. The THC that's being vaped is a hard drug. It's not a soft drug. So we've seen a direct correlation, positive cause between vaping and heroin use. Because the moods get so rough from vaping, high concentration of THC, they've got to level off their moods. So they're going to go to pills, or they're going to go to heroin. So it's no question, it's a moot point that this drug now is a gateway drug, or to skip that thing and just say high concentrated that are vaped are now a hard drug. And parents aren't going to know whether it's 4% THC or 99% THC in the oil. So it's a major problem, major contributing to hospitalization. There's also a medical problem associated with high levels of THC, either smoked by gastroparesis. Kids are going to the hospital with unspecified stomach problems. And they don't know why they're there. But acute stomach pain, not cramping, but pain. It happens so much at the hospital.
Yeah, I want to get on to another question. Thank you, sir. I think it's really important that our drug counselors that we have, you see it, you're in the front line, and so we really appreciate it. And I think if anybody wants to summarize just what he said, I'll try my best. But yeah, the concentration is so much more, which drives the addiction, and then you know, and then it kind of blossoms from there, and just as our participant Tay said, it just leads to other problems, other addictions, and other things. So anybody else want to elaborate more on the comment?
I think you did a nice job summarizing.
Great, thank you. Anybody else in the audience? Question? Yes, go ahead.
If you have, I'm sure you run checks in the lockers and so on with a dog maybe sniffing, can they detect any of these inside of the classroom or on someone?
So your question was, do we run checks with dogs on the lockers? We do not run checks on the lockers with dogs. I don't think we've done one for a few years. That's all from the school. The school has to allow that to happen since it's technically their property. But it has been a conversation in the past that there's certain points of time where we see an increase in the use and possession where we do discuss whether or not it's a good idea to bring some more dogs in to do this. The dogs will hit on the odor of this stuff, so it would help with the, helping us find a location where these items are and who's bringing them into school. I hope that answered your question.
Anybody else here? Yes, ma'am?
Could you educate us please regarding some of the slang that we should be listening for?
So the question is the slang, acronyms, that kind of thing? Panelists?
I think, just some of the ones that I've heard as a parent and through my experience here. Juul is one, as you know, it's one of the devices specifically. The liquid that's put in the vaporizer is commonly referred to as juice. And THC now has a whole other host of acronyms, but you might also hear of CBD, which is another component of the marijuana plant that kids are also using. It's non-psychoactive, but they're using it for other purposes of the way that it makes their body feel, but that's also still not healthy and illegal because they're not of age and it's not legal yet in this state. What are some of the other things maybe that you hear?
Yeah, that's basically the biggest one is just a Juul, since that's what the students are primarily using. I haven't really heard of any other students using any other words.
I think the other thing they would focus on is just the flavor. So you may hear kids saying like, I like mango, or I want, whatever, purple popcorn, or whatever they're, I don't think they get that tech savvy on it. But the Juul is the most common name brand, probably regardless of which vaporizer they're gonna use. So I think you're looking at, talks about flavor, the CBD. There's also wax out there, which is a whole different ballgame, but you're looking for talk about fruits that they're not eating. Could be a tip. And juuling or vaping or nothing overly specific other than that.
Great. Anybody else? Yes, sir?
So as somebody who's fallen victim to the advertising myself, as far as is healthier, I was a regular cigarette smoker and I went to the vaporizing. Now that I've removed myself from that lifestyle, I see how insane my thinking was. But what is your response to these younger kids when they show that disgust to cigarettes and they think this vaping is healthier or better for them?
So the question was what our response is to students that show the disgust to cigarettes when it comes to vaping. So I pretty much tell them that that's our expression when it comes to vaping. We have the same disgust towards vaping. And one thing I forgot to mention that kind of ties into this, when we talk to students that have been caught that haven't smoked cigarettes in the past, and I ask them why, they typically say they like the feeling that they get because they get a buzz off of the vaporizer. So that kind of like rolls into my head of that kids are actually kind of high in school as they're doing it. So I kind of go off of that and tell them that's why I'm kind of disgusted the fact that they enjoy doing it.
I think, in my experience, that look that they get around cigarettes is because you don't see it as much. You know, by the time they came around, it was already banned. It's kind of shunned. So I think we have an uphill battle to get the kids now to look at cigarette smoking the way we look at this and cigarette smoking now. So I think all we can do is promote that it's just like it, that we don't know the lasting effects yet because it's still so new. But the problem is going to be the uphill battle is their friends are still doing it. They're still going to see videos and it's still going to be positive marketing like with the cigarettes once were. So I think it's going to be a time thing. Right now, this is the hot thing that, you know, as all of us when we were teenagers, sometimes you're just going to do what you want to do until you learn otherwise. But the best that we can all do is to keep advising them how bad it is. And then, you know, at some point it's going to sink in.
Yeah. I think one of the conversations that's resonating, we've been in some of the middle schools, is the fact that these very large companies are, the sole purpose of them marketing this product is really to get you addicted. And that these large corporations are really purposefully marketing to you as a kid because they think you're, you know, maybe they think you're vulnerable, they think you're, you know, uninformed, uneducated, but their sole purpose is to get you addicted to their product so that you will continue to use it over your lifespan. They don't care about your health. All they care about is getting you sucked in. Cigarettes were the vehicle for that nicotine and addiction back, you know, when, you know, while ago, I don't know, back when I was a kid. And it's just a different delivery device, but they have the same purpose. And so maybe having some of that conversation with them, you know, it's really that they're trying to accomplish the same thing just with the new product.
Go ahead.
I just also wanted to add in response to that specific question, in regards to the Juvenile Review Board, one of the things that I have instituted is that all youth that come through our program, in addition to their community service hours that they're mandated to serve, I also require them to write a 3-page essay in regards to what they did and why it was not a healthy decision. So it does give them some time to take pause and actually do research on the negative aspects of the vaping and the marijuana use.
Let's get a couple more questions. I see some hands all the way in the back, and then we'll come in front.
So the question is, have any students admitted to being addicted? And my answer is yes. We actually have students that have nicotine patches at the nurse's office for that purpose, where, you know, now they're seeing a therapist, and the therapist had recommended using nicotine patches in order to get off of these items. Yep. So, yep, question is, how would we guide the student through their addiction and helping them get out of their addiction? So we use our social workers in our school to help them, you know, work their issues out, and we also recommend the parents see a therapist, which social services, if you want to talk about that as well, but we also recommend them to see social services who has plans in place to help fund the therapy sessions.
Yep. One of the programs that we provide is called our Family Therapy Program, and we receive funding through the state of Connecticut through our Youth Service Bureau programming. And when I receive a referral from the school or the parent is self-referring, I sit down with the parent and with the child and we discuss what the issues are. And then we have contracted therapists through our office that we then refer them to. And with our funding, we're able to provide 5 free sessions to that individual, to the youth, to the family. And the hope is that we're able to engage them in therapy sessions and help them to get some additional resourcing. And we also try to match them with a therapist that will continue to see them under their insurance following those 5 sessions.
Right. Another question, sir?
A question about the juvenile review board. Are you finding that that's actually a preventive help in aid, or do they come, they go through the process, are you seeing them come back again? Or what's happening with that? Is it effective, I guess, is the question.
At this point, I can't say that I've had...
Repeat the question.
Oh, I'm sorry. So to repeat the question was whether or not we've seen it be an effective tool through the Juvenile Review Board. Have we seen recidivism? Thank you. With the youth and reoffensive. I have not yet put anything in place to track that, but that is something interesting that we should look at. Our police might have a better answer for that. But through the Juvenile Review Board, one of the things that it does is it helps to bring awareness, particularly to the parents that don't know that the children were engaging in these activities. And we often see through the program and through our interviewing that the children then seem to see the light a little bit and will tend to want to stop because now their parents know, now they're being punished, now they have to complete community service, which includes working with the janitors and doing some activities that they might not enjoy. And it also, just brings it to light for them, and we encourage them to go back to school and to let their friends know that I got in trouble, you can get in trouble too. So that's one of our goals.
So to piggyback off, what we see, because social services and JRB is not going to really know if that student had reoffended since it's only a one-time deal where they don't get it again. And out of the 14 incidents in the past, would you say 14 months? I would honestly, don't hold me to the number, but 2 that I can remember had reoffended, and it was the marijuana use that offended. So I would say that it does a good job of trying to help the student out, for sure.
I think we got time for maybe 1 or 2 more questions.
We have an anonymous one up here.
There, over.
First, a comment regarding the relative disgustingness of cigarettes versus vaping. I wouldn't, if I were to chop my finger off, that would be better than chopping my arm off, but I wouldn't want my finger chopped off either. So vaping is, there's nothing good. There's less bad, but there's nothing good. My question, though, is if one of you could address the medical toxicity of nicotine, particularly in those accessible forms. Few of us would think about eating a package of cigarettes, but it would be very bad for us to do that. But these, particularly those bottles of juice, are concentrated nicotine that I would imagine could do a lot of damage if they got in the hands of a younger sibling or a family pet or something like that. So could somebody address that?
Yeah, we are. Or
do the question again.
Oh, the question is, I guess, the extent to which, these vaping devices result in potentially higher levels of nicotine than, say, cigarettes, correct? Something to that. We are seeing reports of actual nicotine poisoning, which is not anything that we've seen attributed to cigarette smoking, but has been attributed to these liquid forms of nicotine that either are being used at extremely high concentrations with the refillable pods, et cetera, vaping pods that are pretty much currently unregulated relative to the nicotine content, and also family members and young children that may get their hands accidentally on some of them. So that is a concern as well.
I think we have time for one more question. All in the back? Yep.
What grade do you start
So.
What, repeat.
I'm sorry. What grade are we starting to see vaping? The state of Connecticut does a youth tobacco and youth behavioral risk factor survey throughout the state of Connecticut, and we're seeing kids as young as 12, 13, and 14 experiment with these products.
And just to add, 2 of our JRB cases in the past year were middle school students.
I do have one written question, if I may, to read it. What have you seen in Simsbury as far as vaping goes? How are we compared to other towns as far as usage in teens?
I mean, I can start by saying that it's challenging for us to collect that type of data for a small geographic unit. We don't have the resources to survey each of our individual towns, so we really rely on state-level data. But we really have no reason to believe that what we're likely to experience in Simsbury or any one of our other 10 towns is that much different from what we're seeing in other towns across the state and the summary data at the state level.
To reinforce that, Officer Kushman and I are part of the State of Connecticut School Resource Officer Group that meets once a month, and that's school resource officers from around the state of Connecticut. And I can tell you honestly that everyone is having this problem. So it's not a Simsbury problem, it's not a Canton problem, it's not a Granby problem. It's a state of Connecticut and United States of America problem.
Yeah. Okay, I think we've really had a really great presentation. I'd like to thank our panelists for their efforts today and bringing knowledge to our folks. There are some other people in the room, so Andy O'Brien, the principal of the high school, is here. The middle school principal, Scott Baker, so I'm going to get it. And then our town manager is here, and Maria Capriello. Oh, close. I was close. Right, Gabriella. Just met her tonight, so thank you for attending, Maria. And then Sue Lemke is here from the Board of Ed and the Superintendent's Office. So please stay around, ask us questions. We're more than happy to answer them for you, and thank you for attending tonight.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.